And welcome back to Noon Edition. We are now visiting with Lori Nestor. She is the breastfeeding coordinator for WIC here in Allen County. And this is Breastfeeding Awareness Month. So you're in here to kind of give us some of the pointers and topics that you guys are trying to get across to moms out there.
Sure, actually whole families and broader communities. So it really is more than just an individual. You need that community of support that helps you, whether you're just interacting with family and friends or in the workplace with childcare. And there's a lot more resources out there than there used to be. So in August, the first week of August internationally is Breastfeeding Awareness Week, and we take the whole month of August then to kind of focus and highlight on the importance of breastfeeding. It impacts mom's health, baby's health, and then does a lot of good things for the environment, for the community. We can talk all day about all those benefits.
Absolutely. Now, there's a couple of awards that can be won. A Breastfeeding Friendly Child Care Award. Tell us about that.
Yes. So Ohio Department of Health launched that award in January of 2020. Right before everything kind of shut down for a while. So it's been kind of a quiet award. Child care providers can do an online 2-hour training. We have some other resources to help them develop policies and think about how they're handling breast milk in the child care center and working with moms who might be breastfeeding. And they can apply for an award that they receive from the Ohio Department of Health. And I think the applications are online and you can submit them anytime. I think they review them quarterly and then issue certificates and some other goodies for that.
Okay, and then there's another award for employers as well.
Yeah, so this just launched last year. We have a very Ohio-specific toolkit with some information on how to help figure out how to provide time and space in your worksite environment for a parent who is needing time to pump. And same kind of a thing. You can go online, you can review some of the materials, develop a policy, some other questions that you have to answer about how you're doing this in your worksite. And again, you can receive an award to display and you get listed as one of the award winners on the Ohio Department of Health website as well as some other places.
Now, I just mentioned the word pump.
Yes.
That is very big right now because about a year ago, maybe a little more than a year ago, the Federal Pump Act was put into place.
Yes, that actually was finally passed in December. And what it does is expand on the protections that were already in existence for many women to include some other categories of people like nurses and teachers and some other just groups of employees that were not included in the original act.
Now, let's talk a little bit more locally about breastfeeding. If someone has some questions, maybe they're having a difficult time. I know that my daughter-in-law just had a baby, and the first couple of days, latching on just wasn't happening. Do you guys have tips? Can you help them with that?
Sure, we do a lot of work with our WIC clients, but we are also able to answer questions from the public. We love to talk to people while they're still pregnant and able to kind of help prepare for some of the things you need to be thinking about before you even go in to have your baby. We connect people with a lot of local resources through our local hospitals, other WIC agencies. If you're in a different county and we happen to be talking to you, we can provide resources to OB offices and pediatricians' offices and other healthcare providers as well. And we work closely with other, like our in-home, like Help Me Grow, some of the home visiting programs, just to make sure the information is out there. And then we do take a lot of questions from parents after they've had their baby, if they're having questions or difficulties. We don't have a lactation consultant on our staff specifically to see clients, but we do refer out to others in the community.
Lori, thank you so much for your time today. Always a pleasure to speak with you. And we're back with a look at medical coming up next.